This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Lalema Aneja Dang, and with me is R.S. Raghu. The headlines. Government says cluster containment strategies and rigorous contact tracing being used in COVID-19 hotspots to check the virus from further spreading. Home Secretary Ajay Bhalla says strictest action will be taken against those who violated visa rules and travelled to India recently. FIRs to be registered against rumour mongers. 227 fresh cases of COVID-19 reported across the country in the last 24 hours. Total number goes up to 1,251. More than 100 recovered so far. Indian Council of Agricultural Research asks farmers and workers to follow precautions and safety measures to prevent the spread of coronavirus. Railways to modify 20,000 coaches to accommodate over 3 lakh beds for isolation. And India calls for creating global framework for further enhancing access to medicines for fighting COVID-19 pandemic. The government is using cluster containment strategies and doing rigorous contact tracing in COVID-19 hotspots to check the virus from further spreading. Briefing media in New Delhi today, Joint Secretary in the Ministry of Health, Love Agarwal, said with over 1,200 cases of COVID-19, the number of hotspots in the country has increased. Mr. Agarwal said 227 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the past 24 hours in the country. With this, the total number of cases has now gone up to 1,251.
केसेस में आए इस इंक्रीज का कारण है कि कुछ लोकेशंस पर लोगों के सपोर्ट न मिलने से समय पे सूचित न करने के कारण अचानक केसेस की संख्या में ये इंक्रीज नोट किया गया है। कोविड-19 की लड़ाई में हम उतने ही सक्सेसफुल हो पाएंगे जितना हमें कम्युनिटी में सबका सपोर्ट मिलेगा। इस जंग में किसी भी एक समाज के व्यक्ति का सपोर्ट न मिलने पर पूरे समाज को उसका नुकसान उठाना पड़ेगा।
3 deaths have been reported in the last 24 hours, one each from Gujarat, West Bengal and Madhya Pradesh. Mr. Agarwal also informed that government has formed an empowered committee led by Dr. Vinod Paul, member Niti Aayog, and Professor K. Vijay Raghavan, principal scientific advisor to Prime Minister, which will focus on research and development and coordinate with various scientific agencies, regulatory bodies and private industry to work on countering COVID-19. He said 101 people have been cured and discharged. Dr. Raman R. Gangakherkar of Indian Council of Medical Research ICMR said over 42,000 samples have been tested so far.
अभी तक हम लोगों ने 42,788 सैंपल्स टेस्ट किए हैं। कल 4,346 सैंपल्स टेस्ट हुए, विच रिप्रेजेंट्स 36% ऑफ आवर कैपेसिटी। अभी इस वक्त 123 लैब्स फंक्शनल हो चुके हैं। प्राइवेट लैब्स में 49 लैब्स को परमिशन दे चुके हैं और कल प्राइवेट लैब्स में 399 पेशेंट्स की जांच हो चुकी है।
Dr. Raman R. Gangakherkar informed that ICMR is working with the Department of Biotechnology and Council of Scientific and Industrial Research CSIR on the agenda of developing a vaccine for the COVID-19 disease. Joint Secretary in the Home Ministry, Punya Salila Srivastav, said over 21,000 relief camps have been set up in various states and union territories, which can shelter over 6 lakh people. She said facilities have been set up to feed over 23 lakh people.
ये सुविधाएं जो पुअर और डेस्टिट्यूट है उनको उपलब्ध हैं, ये स्ट्रैंडेड माइग्रेंट वर्कर्स को भी उपलब्ध है, ये उन वर्कर्स को भी उपलब्ध है जिनको सिर्फ भोजन की आवश्यकता है, और ये सुविधाएं उनको भी उपलब्ध हैं जो अपने गंतव्य स्थान पर पहुंच गए हैं लेकिन स्टैंडर्ड हेल्थ प्रोटोकॉल के अनुसार क्वारंटाइंड है। माइग्रेंट वर्कर्स की स्थिति नियंत्रण में है। इंटर स्टेट कार्गो मूवमेंट स्मूथली चल रहा है। जहां भी कोई भी समस्या हमारे संज्ञान में लाई जाती है वहां हम तुरंत उसके निदान के लिए कार्रवाई करते हैं।
Meanwhile, Home Secretary Ajay Bhalla has said that strictest action, including blacklisting, will be taken against those who violated visa rules and travelled to India recently. He also said that FIRs will be registered against those spreading rumours related to COVID-19, the disease caused by the new coronavirus, under the Disaster Management Act. The government today said that it is committed to identify, isolate and quarantine COVID-19 positive Tabligh Jamaat workers in India post their congregation in Nizamuddin, Delhi. The Home Ministry had shared details of Tabligh Jamaat workers in India with all the states on the 21st of this month after COVID-19 positive cases surfaced in Telangana. By Sunday, nearly 162 Tabligh Jamaat workers were medically screened and shifted to quarantine facilities. The state police will examine visas of all these foreign workers and take further action in case of violation of visa conditions. Instructions were also issued by the Home Ministry to Chief Secretaries and DGPs of all the states as well as the Delhi Police Commissioner. Meanwhile, the workers staying in the Markaz in Nizamuddin, Delhi were also persuaded for medical screening by the state authorities and the police. The Delhi police has registered case against Maulana Saad and others of Nizamuddin Markaz. The case was registered against them for violation of government directions given to the management of Markaz of Basti Nizamuddin regarding restriction of social, political, religious gathering and for taking safety measures for the prevention and treatment of COVID-19 viral infection. Here's more from our correspondent.
The Delhi police has cordoned off a major area in Nizamuddin West in the city where many people showed symptoms of coronavirus after taking part in the religious congregation Tabligh Jamaat held earlier this month. Drones are being deployed to ensure strict implementation of lockdown. Over 2,000 delegates, including from Indonesia and Malaysia, attended the congregation after the government banned social gatherings. After attending the congregation, the participants left for various states. Some of them later developed symptoms of COVID-19, but that went unnoticed until a 65-year-old man resident of Jammu and Kashmir died on Thursday. 24 people who took part in the religious congregation have tested positive for the novel coronavirus. 700 people who attended the congregation have been quarantined, while around 400 people have been admitted to hospitals, and screening of all those who participated in the event is being conducted by the government. Anupam Mishra, AR News, Delhi.
Earlier, Delhi Chief Minister Arvind Kejriwal today said the government has written to LG Anil Baijal to order registration of an FIR against those who organized the Markaz gathering at Nizamuddin. In the wake of the growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene and restriction of mass gatherings. Here's a report.
Government has said that there is enough supply of essential items and people need not worry and rush to marketplaces. People are advised to have patience and keep calm while shopping for essential goods and medical supplies. Frequent trips to buy essential items should be avoided and people should refrain from shaking hands and hugging as a matter of greeting. At least 1 meter distance should be maintained by people at marketplaces, medical stores and hospitals. Non-essential social gatherings at home should be avoided and visitors at home should not be allowed. People should not touch their eyes, nose and mouth, and frequent hand sanitation is a must. Both sides of hand have to be washed for at least 20 seconds. If a person is experiencing cough and fever or any other symptoms, he or she should avoid close contact with others and doctors should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for enquiry about coronavirus. All Indians must do their bit and keep themselves and others safe in this fight against COVID-19. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
In the wake of COVID-19 spread, Indian Council of Agricultural Research (ICAR) has asked farmers and workers to follow precautions and safety measures to prevent the spread of the disease. ICAR has issued advisory for farmers during harvesting and threshing of rabi crops. Agriculture Ministry asked workers to follow safety measures and social distancing at each and every step in the entire process of field operations. The ministry said that all people engaged should use masks and ensure hand washing with soap at reasonable intervals. All machines should be sanitized at the entry point at regular intervals. All transport vehicles, gunny bags or other packaging material should also be sanitized. The ministry asked farmers to prefer mechanized operations over the manual wherever feasible. Only the essential number of persons should be allowed to accompany the machine. Government today clarified that central government employees who are attaining the age of superannuation today shall retire from government service today itself, irrespective of whether they are working from home or working from office. In an office memorandum, Department of Personnel and Training DOPT informed about it. Centre has extended the validity of health organizations already empaneled under Central Government Health Scheme CGHS. An order issued by the Ministry of Health and Family Welfare said this extension will be valid till 30th June this year on the next date of empanelment, whichever is earlier, on the same terms and conditions and rates. Jammu and Kashmir Union Territory Administration has decided that all those doctors who have retired from 31st March 2018 till date can be re-engaged for further duties for 1 year. The administration has also decided that all the health department officials who are to retire in next 6 months can continue till March next year. Skill Development and Entrepreneurship Minister Dr. Mahendra Nath Pandey has said that apprentices will continue to get their full stipend during COVID-19 lockdown. He said all establishments shall pay full stipend as applicable to the apprentices engaged under both designated and optional trade. Road Transport and Highways Ministry has extended the validity of documents like driving licenses, permits and registration that expired since 1st of February. In an advisory to all states and union territories, the ministry has asked them to treat such documents as valid till June 30th. As part of COVID-19 preparedness, Railways is ready to modify 20,000 coaches which can accommodate over 3 lakh beds for isolation needs. Ministry of Railway said isolation coaches being prepared for COVID-19 patients will be equipped with all necessary facilities. 5 zonal railways have already prepared prototypes for the quarantine or isolation coaches. These coaches will be having capacity to accommodate up to 80,000 beds. One coach is expected to have 16 beds for isolation. More than 280 special economic zones (SEZs) units engaged in manufacturing of essential items like drugs, pharmaceuticals and hospital equipment are operational to ensure critical supplies amid the national lockdown. SEZs are significant contributor to the export from India, contributing approximately 18% of India's total exports. Haryana government has designated 3 private laboratories in Gurugram district for COVID-19 testing in the state. The private labs shall carry out COVID-19 testing as per guidelines of ICMR, Ministry of Health and Family Welfare. Maharashtra government today clarified that it would disburse the salaries for the month of March of people's representatives, government officers and employees in the next 2 installments. A government resolution clarifying the decision was issued this evening. In Gujarat, the government will distribute free ration to around 3.25 crore needy people in state from tomorrow in wake of 21 days lockdown. Our correspondent reports that the government has also announced to distribute 1 month's free ration to migrant workers from 4th of April. More from our correspondent.
In view of the prevailing lockdown situation, government will distribute essential ration to more than 66 lakhs Antyodaya families through around 17,000 fair price shops. Secretary to CM Ashwini Kumar said 3-member teams have been formed to ensure smooth distribution and avoid crowd at the shop. He said migrant workers who do not have ration cards will also be given free ration from coming 4th April through Anna Brahma Yojana. CM asked district administration to ensure that all the flour mills in the urban as well as rural areas remain open during the lockdown. Aparna, Air News, Ahmedabad.
In Rajasthan, number of COVID-19 positive cases has risen to 93, which includes 17 evacuees from Iran. As per the report issued by the Health Department, 14 more persons tested positive today in the state. Our correspondent reports the state government has extended the retirement period of doctors and other health workers up to 6 months.
Home delivery of essential commodities is being done by the administration in many districts of the state, including Jaipur, so that people do not have to go outside of their home. Food and accommodation are being provided by the administration to resourceless persons. Many social, religious and business organizations are also helping in this work. More than 3 crore 26 lakh people have been screened across the state by more than 27,000 teams of health departments so far. Curfew continues in the walled city area of capital Jaipur and house-to-house survey are being done. Jitendra Dwivedi, AIR News, Jaipur.
Amidst the rising cases of COVID-19 in the country and the need for ventilators to give life support to the elderly persons, Indian Institute of Technology Kanpur is working on portable ventilator. The prototype of this ventilator will be ready very soon, and just after assembling, it can be used as a life support system. More from our correspondent.
Ventilator is a very important medical equipment for COVID-19 patients, especially those who are old and the virus can prove fatal to them. Keeping this in mind, Bioscience and Bioengineering Department of IIT Kanpur has prepared a design of lifesaver portable ventilator. A team of experts from IIT is working for early production of this portable ventilator. Professor Amitabh Bandyopadhyay told AIR that there will be need of thousands of portable ventilators in future to strengthen the health system of country.
हमारे मैकेनिकल इंजीनियरिंग के प्रोफेसर्स हैं, टेक्निकल एडवाइस दे रहे हैं, और उधर से डॉक्टर दीपक पद्मनाभन नारायण हृदयालय बेंगलुरु का जो कि मेडिकल इनपुट दे रहे हैं, ये सब इनपुट लेके हमारे इंक्यूबेटेड कंपनी निखिल कुरेले और हर्षित राठौर द्वारा नोका रोबोटिक्स, उन्होंने ये डिजाइन बना लिए हैं. अब उनको सिर्फ असेंबल करके ये बनाना है, जिसके लिए एक ग्रुप है केयरिंग इंडियंस करके, जो एक क्राउडसोर्स प्लेटफॉर्म है, जो इनको मदद कर रहे हैं हर एक तरीके से, ताकि अगले 7 दिन में हम प्रोटोटाइप बना पाए.
Professor Amitabh said that in 1 month, we will be able to produce maximum number of ventilators to save the lives of general public. With Rajesh Srivastav from Kanpur, this is Sushil Chandra Tiwari, AIR News, Lucknow.
This is All India Radio, giving you a special program on COVID-19. Let's take a look at the headlines once again. Government says cluster containment strategies and rigorous contact tracing being used in COVID-19 hotspots to check the virus from further spreading. Home Secretary Ajay Bhalla says strictest action will be taken against those who violated visa rules and travelled to India recently. FIRs to be registered against rumour mongers. 227 fresh cases of COVID-19 reported across the country in last 24 hours. Total number goes up to 1,251, more than 100 recovered so far. Indian Council of Agricultural Research asks farmers and workers to follow precautions and safety measures to prevent the spread of coronavirus. Railways to modify 20,000 coaches to accommodate over 3 lakhs beds for isolation. And India calls for creating global framework for further enhancing access to medicines for fighting COVID-19 pandemic. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The J&K government has informed that 6 new positive cases of novel coronavirus COVID-19, all from the Kashmir division, and contacts of previous positive cases were reported today. With these fresh cases, the total number of positive cases in Jammu and Kashmir has risen to 55. In case of any emergency, people can avail free ambulance services 24/7 at their doorsteps by calling on toll-free number 108. Pregnant women and sick infants can avail free ambulance services by dialing toll-free number 102. The government has also set up helpline numbers in this regard. 0191 254 9676. This is the Union Territory level cell for J&K. 0191 252 0982, 0191 267 4444, and 0191 2674 115 for the Jammu division. 0194 244 0283 and 0194 243 0581 for the Kashmir division. The Union Territory Administration in Jammu and Kashmir has been tirelessly reaching out to the people and trying to mitigate their sufferings due to the prevailing circumstances following the outbreak of COVID-19 pandemic. Our Srinagar correspondent has the details.
The number of COVID patients in Jammu and Kashmir has risen to 55 as 6 new positive cases have emerged out in Kashmir division today. The government is in the process of re-engaging the doctors and paramedical staff who are retiring within 6 months for 1 more year. More than 2,400 beds in J&K hospitals have been made ready for meeting any eventuality. The district administration Bandipora has disbursed 1.29 crores, Kupwara has disbursed 2.59 crores, Kulgam 84.79 lakhs as a cash assistance among construction workers through direct benefit transfer. This is Sunil Kohl for AIR News from Srinagar.
In Tamil Nadu, nearly 4 lakh people have been screened for symptoms of the novel coronavirus infection and other diseases. The initiative has been taken under the containment plan that is in operation in 12 districts including Chennai, where COVID-19 cases have been reported. The government has said the surveillance would continue for more days. Meanwhile, in Tamil Nadu, 7 new cases of COVID-19 were reported today, taking the total to 74. All are those with travel history to places in other states affected by the novel coronavirus, including Delhi. Here's more from our correspondent.
As the days go by under lockdown, the level of compliance has observably gone up, with people coming to terms with the reality of the COVID-19 situation. The government has established dedicated telephone lines in each district for counseling to help those in need. To overcome any problem of shortage of doctors and paramedical staff, the state government has issued an order to employ those who retire today on superannuation for 2 more months on a temporary basis. Jai Singh, AIR News, Chennai.
Karnataka has harnessed technology to galvanize its efforts to counter COVID-19 pandemic. The 10-member task force on COVID-19 is utilizing IT applications, GPS and mobile app to track individuals suspected of novel coronavirus infection. Here's more from our Bengaluru correspondent.
The task force on COVID-19 pandemic will be using Corona Watch mobile app to keep track of quarantined persons. Quarantined persons have to declare the location every hour during the 14-day period. If someone fails to share the location, then the police and quarantine enforcement team are mandated to visit such a home quarantined person and put him in government quarantine institution. This location detail, which is geotagged with date and time, will be available to public and they can avoid going near the quarantined persons. The Secretary, Administrative Reforms and member of State Task Force for Containing COVID-19, Munish Maudgil, spoke to AIR about the IT applications being used by them to combat coronavirus.
The tracking of all of them manually on a paper is very, very tedious and not possible. So technology will help in tracking these people by logging the details of them. Any person you come in close contact with, the technologically we'll be able to know from the app every person who got in touch, connect close vicinity of another person. So if 5 people got in touch with each other, if one of them turns positive, from the person who turns positive, we are able to understand and get the details of the other 4 who he was in touch with, and then we can notify these people from technology rather than physically searching them. So in this context, we have released one app called Corona Watch.
The task force is using software and data from telecom service providers to get information on any person who is in touch with a quarantined person. The tower location information, telecom providers and the mobile app thereby notify people about their possible interaction with COVID positive persons. Sudhindra, AIR News, Bengaluru.
In Kerala, 7 more COVID-19 positive cases are confirmed, taking the total number of infected patients in the state to 220. More than 1,69,000 people are under observation in the state. Meanwhile, in an achievement, an elderly couple aged 93 and 88 years have completely recovered from the deadly infection after remaining critical for many days. Our correspondent has the details.
Hailing from Rani in Pathanamthitta, the aged couple received the infection through primary contact from their son, daughter-in-law and grandson who all returned from Italy, all of whom tested positive for the disease early this month. The aged couple were under the treatment of Kottayam Medical College Hospital. As they were already suffering from various age-related diseases, their condition was very critical in one phase of the treatment as per the health department. The State Health Minister K.K. Shailaja said that the expert treatment and care given at the Kottayam Medical College had brought them back to the life, and she congratulated all those who toiled hard for their recovery. Along with the 7-member team of doctors who led the treatment, 40 medical staff including 25 nurses actively took part in various stages of treatment. At present, the condition of the old couple is satisfactory and the doctors said that they would be discharged soon. Ms. Shailaja said that the recovery of this elderly couple from COVID-19 brings lot of hope and confidence in our system when many countries are struggling to save the lives, especially of old age individuals. Mayusha from Thiruvananthapuram.
In Haryana, 2 COVID-19 patients in Panipat and 1 in Palwal have been cured and discharged today. With this, the number of patients who have defeated COVID-19 so far has risen to 10 in the state. People across the country are following government's appeal to stay in their homes during the lockdown period. We spoke to a couple of persons who shared how they are utilizing their time during the lockdown.
I'm Vikas Panikar from Kozhikode, Kerala, which is also known as Calicut. I am a media professional. This period has given me time to read books and I listen to music. I've just recently shifted to Kerala, so it's good that I'm using this break as a time to catch up in my own family. So that is a good thing out of this.
I'm Simple Mishra from Bhubaneswar. I am spending my days by reading, by finishing projects, and by managing everything in a house setup. This has been a time to meditate, to self-reflect, and a break that has come as a welcome change.
In our series, Experts Speak, we bring you the views of the leading medical experts on COVID-19. Dr. Anand Mohan, head of pulmonary medicine, AIIMS, has advised people not to take medicines like hydroxychloroquine or an anti-malarial drug without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other antimalarials without a proper prescription by a doctor. Do not self-medicate.
Ms. Jacinta Gunchial, Senior Nursing Officer, AIIMS, has stressed on the need for social distancing.
Social distancing is a non-pharmaceutical infection prevention and control intervention to break the chain of infection.
Well, for listening to other experts, tune in to our next bulletin. The government has come across reports in a section of social media which shows pH values of select food items and tells that people should have more intake of alkaline foods that are above the pH level of the novel coronavirus. The report refers to the findings of the research study published in the Journal of Virology and Antiviral Research. Well, this is fake news and is factually incorrect. Army Wives Welfare Organization AWWO today handed over 2,500 food packets to the government of National Capital Territory of Delhi for distribution to the needy people during the lockdown due to the COVID-19 pandemic. The food packet distribution free of charge will continue for 5 days.
India has called for creating global framework for further enhancing affordable access to medicines for fighting pandemics and facilitating easier movement of health professionals across national borders. During the meeting of trade and investment ministers of the G20 and guest countries, Commerce and Industry Minister Piyush Goyal stressed on the need to uphold multilateral commitments and improve upon its effectiveness to meet current challenges. Government of India has come up with a portal for the foreign tourists stuck in various parts of the country. The portal, strandedinIndia.com, will disseminate information regarding the services that can be availed by foreign tourists. The portal contains comprehensive information around COVID-19 helpline numbers or call centers, a variety of information about Ministry of External Affairs control centers, and state-based and regional tourism support infrastructure. Days after Nepal imposed complete lockdown due to COVID-19 outbreak, hundreds of stranded Americans left the country on a repatriation flight today. The Dubai government has said that it will extend its full support to its national carrier Emirates Airlines in these difficult times where airlines have been massively hit worldwide due to the outbreak of COVID-19. The News Services Division of All India Radio in its bilingual live phone-in program today, 31st of March 2020, will bring you a discussion on measures to prevent COVID-19 infection under Corona Jagrukta series. Dr. K. Srinath Reddy, President of Public Health Foundation of India and former Head of Department of Cardiology at All India Institute of Medical Sciences, AIIMS, will participate in the discussion. Listeners can ask questions to the experts sitting in our studio on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by #AskAIR. This can be heard tonight on FM Gold Channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and at our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
And now, before we end this special news program on COVID-19, the headlines once again. Government says cluster containment strategies and rigorous contact tracing being used in COVID-19 hotspots to check the virus from further spreading. Home Secretary Ajay Bhalla says strictest action will be taken against those who violated visa rules and travelled to India recently. FIRs to be registered against rumour mongers. 227 fresh cases of COVID-19 reported across the country in the last 24 hours. Total number goes up to 1,251, more than 100 recovered so far. Indian Council of Agricultural Research asks farmers and workers to follow precautions and safety measures to prevent the spread of coronavirus. Railways to modify 20,000 coaches to accommodate over 3 lakh beds for isolation. And India calls for creating global framework for further enhancing access to medicines for fighting COVID-19 pandemic. With that, we end the special.